South Africa is home to one of the world's largest and most comprehensive HIV/AIDS programs supporting over 8 million people. But the abrupt suspension of $400 million in annual PEPFAR funding by the Trump administration has closed clinics, displaced 15,000 health workers, and disrupted care, putting pregnant women and newborns at renewed risk of infection and preventable death. This clinic in Gugulethu was once a lifeline in South Africa's HIV response, but today it's eerily quiet. Testing rooms are closed, staff gone. It's one of many facilities that has been hard hit by the sudden withdrawal of US funding. This maternity unit once relied on PEPFAR-funded counselors. Now, with those roles gone, even basic testing for expectant mothers is a challenge.
Our patients are suffering, and the cut has done so much damage that we are not able to follow through our patients. Imagine if you no longer get your treatment, your HIV treatment, and it's going to cause a lot of damage in your body, and you end up dying.
You'll start to see the ripple effects quite fast. For Africa and South Africa specifically, we have high levels of HIV. We have TB infections, which we know escalates. And so my message would be that ultimately we shouldn't be looking at the money. It's about looking at lives, looking at livelihoods, looking at babies who would lose their mothers to HIV if moms don't get cared for.
To understand just how deep the damage goes, I met with Professor Landon Meyer at the University of Cape Town. For over 25 years, the university has been at the forefront of global HIV/AIDS research.
Overnight, in many instances, entire sections of our HIV care and treatment services have been removed. They've been deleted from existence. People literally received their job notices and were fired over a weekend. And the impact of this is something that we're only even beginning to get a sense of.
Thanks to PEPFAR-backed programs, South Africa had reduced mother-to-child HIV transmission from 30% to under 1%, a milestone now under threat.
We will see, inevitably now, more pediatric HIV infections. And over time, over the next few months and years, we'll see more adult HIV deaths. South Africa is, of course, well-resourced compared to other countries in the region. I think what we'll see globally is a resurgence of HIV, and with it a resurgence of TB.
Beyond clinics, cuts to the US NIH funding have also frozen crucial HIV research, jeopardizing the search for new treatments, vaccines, and prevention strategies.
We have experiments that are taking place in the building behind us, for instance, and those studies are no longer operating. All the gains we've made in HIV over the last 20 or 30 years, they came through science. And now the next 30 years of gains have been eroded.
From life-saving treatment to critical research, South Africa's HIV fight is faltering, and without urgent intervention, the damage could become irreversible. The country has long been a global leader in HIV care and innovation, but as funding dries up, that progress and lives hang in the balance. Julie Shara, CGTN, Cape Town.